Are you struggling with knee pain? Well, what if I told you that working on strengthening your knee is the key ingredient in getting rid of that knee pain and getting back to the things you love? Let me explain. Rehab. Welcome back to the channel. Dr. Adelle Spenner here, and today we are going to be helping you address that pesky knee pain that you may be dealing with. Many of you may not know this, but the knee just so happens to be my favorite joint in the body to treat. So I'm very excited to spill the knee tea with you today. Now, before getting into the good stuff, it's important to have a basic understanding of knee anatomy. The knee joint is a synovial joint, meaning the joint is filled with fluid that helps bring nutrients to your knee and lubricate it for fluid movement. It is made of several ligaments, including your ACL, deep in there, which many of you might have heard of. These ligaments help stabilize and control the range of motion at your knee. You also have two menisci, one on the inside and one on the outside. These menisci help with congruency of the joint and help to distribute forces more evenly across the joint under load. Next, you've got this funny little kneecap. Many of you might have heard of it. It's called our patellofemoral joint. And this part of the knee is actually responsible for improved efficiency during movement and acts as a lever every time you bend or straighten your knee. Now, we all know your knee bends and straightens, but did you also know it rotates too? With all these anatomical structures in mind, it's easy to understand that the knee pain may not be as simple as we think. And don't even get me started on the effects of your hips, ankles, and biopsychosocial factors that may be having an effect on your knee as well. More to come on that later. So let's dive into different types of knee pain next with two things in mind. This is meant to be a general overview of some common reasons for knee pain and loading strategies to help decrease the fear and confusion around loading the knee when you're in pain. Not all knees present or respond the same way to treatment, so make sure you modify load when needed. It's important to gain a good understanding of what type of knee pain can be addressed with mobility exercise and progressive loading versus what may need further medical attention. If you're dealing with acute knee pain as a result of severe trauma, further medical follow-up may be warranted, and we recommend consulting with your medical team if necessary to rule in or rule out fractures and possibly secondary complications. We can assess the risk of fracture by using the Ottawa knee rules, and X-ray is indicated after an acute injury if you fall into any of these categories. Now, there are a lot of other injuries that can happen from an acute injury, like an ACL or an MCL tear, or maybe just a sprain, hamstring strains, a meniscus tear, or even a cartilage injury. However, most of these injuries are not emergency situations, and a visit to a doctor can be deferred. And even better than that, most of these injuries can be addressed with proper rehab program. The other main reason for knee pain is an overuse injury. Symptoms associated with arthritis, patellofemoral pain, and tendinopathies can gradually creep up over time. Now, these words may sound foreign and confusing, but if you're dealing with arthritis, runner's knee, jumper's knee, or a T-band pain, we're talking to you. Now that we have a better understanding of some of the most common reasons for knee pain, I want to help you understand how and why working on strength can be such a game changer. As always, you want to make sure you have enough mobility at the joints above and below to allow your knee the freedom to do what it needs to do. But we'll save that for another time. First up, let's talk about isometric exercises. We love isometrics for so many reasons. There is research that supports these types of exercises can serve a role in muscle hypertrophy, and that they also serve as an analgesic to help with pain by performing 5 reps for 45 seconds with a 90-second rest in between. This type of loading is exceptionally effective for people dealing with any sort of tendon pain, as well as people who just have limitations with loading because of pain. We tend to tolerate more load with isometrics than we can with other types of exercises as well, which allows us to get stronger and get your knees used to heavy loads with less pain. Now, if you're feeling up to the challenge, try a wall sit. We can adjust the angle to what feels comfortable, generally recognizing that a discomfort level of a 3 to 4 to 10 is okay with the performance of these exercises. Thinking of pushing the ground out from under you through your toes will help you with better recruitment of your quadriceps muscle, which can help with knee pain. The key to making these effective is making them challenging enough. The harder you push into the wall, the harder you work. Or maybe you even try a harder variation on your toes, add some weight, or maybe single leg variations. And when you feel good there, give the good old Spanish squat a try. If this seems too advanced for you, we can help accomplish a similar type of isometric contraction of the quads by sitting in a chair, pushing your toes into the ground again, thinking about pushing the ground away from you as hard as you can. Here, we want about 60 degrees of knee flexion, so thinking of not having our foot completely under us, but slightly out. And the same parameters apply. 5 reps, 45 seconds with a 90-second break in between. This will load your knee similarly to a knee extension machine, but as an isometric contraction. Next, let's discuss the dreaded idea of knees over toes. You may have been told that having your knees advance over your toes is the worst possible thing you can do for your knees. Well, we hate to break it to you, but it's simply just not true. Allowing our knee to go over your toes is not only a great way to strengthen your quads, but is the best way to build capacity and resiliency of your knee joint. Think about it. Try to go downstairs or run without your knees going over your toes. It's physically impossible. Now, the only caveat to this is making sure you have adequate mobility to do so. If you don't have enough ankle dorsiflexion mobility, for example, then your poor knees are out of luck, and yeah, knees over toes probably isn't going to feel that great, and you're going to have to modify. So if that sounds like you know what to do. When progressing knees over toes, I always like to encourage a double leg variation first, which in theory is the least amount of load, about 50% of your body weight. Then progress to a split stance, maybe close to 75% of your body weight. And then when you're good and ready, progress to one leg. These exercises can be very crucial to a healthy knee. All right, now onto those hamstrings. Our hamstrings are made up of 3 muscles that cross the back of the knee joint and are the main muscle group responsible for knee flexion and hip extension. One of the most common hamstring injuries is a hamstring strain, which can take anywhere from 3 weeks to 3 months to heal. So it's important to progressively load them during that time to build capacity and work towards higher level activities such as running and sprinting. That means training them under varying loads, at different angles, different lengths, and different tempos. But remember, knee pain and rehab just isn't about the knee. We also want to think about the muscles above and below the knee joint. Let's take the calf, for example. Not only does it physically cross the knee joint, but let's think about it. Every step you take, the force is transmitted from the ground to the foot, through your ankle, and then up to your knee. That means your calf needs to be able to transfer and translate that load up your kinetic chain effectively. So consider starting simple with double leg heel raises to something like single leg heel raises. Then progress to something that involves your hips and your core a little bit more like a bridge with the heel raise, to something even more challenging like a Captain Morgan with a single leg heel raise. Speaking of the hip and core muscles, you know we weren't going to get through this video without talking about these very important proximal muscles. Exercises like these will not only ensure that your program is well-rounded to return back to the demands of your sport, gym routine, so on and so forth, but they will challenge your lateral hip stability, glute strength, and core musculature to give your knee the support it deserves and needs to thrive. The important thing here is that we are progressively finding ways to challenge these muscles because they are all important in regards to overall knee health. Okay, so I know that was a lot, but bottom line, remember, a strong knee is a healthy knee. If you are looking to take the guesswork out of your journey, be sure to check out all of our knee programs on the Prehab app. Until next time, Prehab, here's to happy strengthening and happy knees.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.